Good morning, everyone. Welcome back to my, once again, long overdue video. I'm pretty sure I'm just going to stop saying when I'll post the next video because as soon as I say that's when I'm going to do it, it's pretty much guaranteed that I'm not going to do it. So I decided that I would sit down today. A lot of the reason being that I am procrastinating. So we are leaving tomorrow to drive back to Illinois for the holidays, which we're so excited about. But I have a lot of like packing and organizing and things that I need to be doing. So naturally, I don't want to do that. So I just decided to sit down and film this video. So today's update will be basically over weeks 12 and 13. I'll talk about, we had our NT scan last week and I had my first OB appointment last week. So a few things to talk about here. So how I'm feeling, I feel good. I feel about the same as I've felt honestly the entire time. I don't think in these last 2 weeks I've really had any nausea per se. I did have a moment over the weekend when I was making breakfast, and I'm just gonna add this in there that like I feel like pregnancy brain has really like set in. I was making some scrambled eggs and I like to add what's it called? Is it powdered onion? Ground onion? Onion powder. Oh my god. This is basically how I am all the time. Onion powder. I like to add a little bit of onion powder. And the cap is the kind that like if you lift one side, it's the sprinkle side. If you lift the other, it's like the pour side. And of course I lifted the pour side. So I dumped probably, a good 6 tablespoons of onion powder into my batter. So I went and I just like scooped it out because you know how like whipped eggs are whipped, beaten eggs. It's not like a thin consistency. So basically it was all just sitting on top. So it was salvage, but I spooned it just like into the sink and then turned the water on to rinse it down. And like as soon as the water hit it, it wafted the smell of the onion up into my face and I definitely gagged. But other than that, I've been feeling good. You know, I still take usually I take a nap a day. I feel like there were a few times in the last week that I didn't take a nap, which is, you know, it's fine. But overall, I'm feeling good. I definitely feel a lot of action in my belly. Not like movement action, but just like it's expanding, lots of tugging and pulling. I definitely get a fair amount around ligament pain. But that's basically how I'm feeling, which is pretty good. Hopefully that continues. So I'll start with my OB appointment last week. So my prior appointment I had was just with a nurse to go over like all my health history stuff that nobody cares about. I guess the office cares about it. It was not an exciting visit for me, whatever. So then last week, I had my first appointment with my doctor and it went really, really well. I still really like her. She just takes a lot of time to like sit down and explain everything, and she gives me a lot of opportunity to ask all of my questions, and I actually asked all of my questions, which is a big deal for me. Sometimes I struggle with, you know, like feeling like, oh, that's a stupid question, or not wanting to bother people. So I definitely, you know, I let her do her spiel, and any questions that she did not answer, I definitely asked them. But yeah, the appointment went well. She did a quick little ultrasound. We got to see the baby. Well, I guess I got to see the baby. Chris wasn't able to go to that appointment. If you see me looking over, I have notes because I can't trust my brain at this point to remember the things that I need to remember. So one of the things that I am I'm feeling better about it, but kind of stressed out about it is my weight gain. Definitely since going off of keto, you know, I feel like my weight, since I've reintroduced carbs into my diet, my weight is just slowly creeping up. And I was informed on my very first OB visit that they only want me to gain between 11 and 20 pounds, which feels like an impossible goal, but nonetheless, that's the goal. So I just kind of talked to her about that, and like that it's really kind of stressing me out, and certainly like me being stressed makes me want to eat more. It's just like this whole vicious cycle. But she was very reassuring. She said, you know what, just do the best you can. And she gave me actually a really good tip. And she said to try to make sure that I'm always eating a protein with my carbs. So she said, you know, unopposed carbs, meaning I'm eating any carb without a protein, is when you get into trouble, like with blood sugar levels and insulin resistance and all of that. So she said, as long as I'm making sure that I up my protein, and she said it doesn't, you know, don't worry about what kind of protein. It can be a high fat protein, it could be, you know, a lean protein, whatever. As long as I'm getting my protein with my, you know, carbs, and obviously trying to stick with complex carbs as opposed to simple carbohydrates, she said, you'll be fine. So that actually helped a lot. And so that's definitely something I'm trying to focus on. So, you know, admittedly, I'm not a huge vegetable eater. I don't really eat salads, but like if I were to eat a salad, making sure that I've got a protein with it. So, I found that to be helpful, very reassuring. So I'm definitely feeling better about it in general. I am not weighing myself at home. For me, I think a lot of women, especially women that have struggled with their weight, have a not so great relationship with their scale. So I'm just not weighing myself because I really don't need to see the numbers slowly increasing and increasing, and that's really just going to be very triggering for me. And I don't need to really like be worrying about that right now. So that's where we're at there. She told me I could stop my progesterone, so I've officially been off of my progesterone for a full week, and it has been just a little slice of heaven. I'm not gonna lie. Like, obviously, I'm gonna do whatever I need to do to make sure that my pregnancy maintains and continues on the way that it should. But I was getting real tired of like just like shoving things up there twice a day, you know, having to wear panty liners all the time. In the grand scheme of like annoying things, it was very minor, but it has felt like a luxury, you know, to just kind of be able to not worry about, oh, is it 7 a.m.? Oh, is it 7 p.m.? I gotta, you know, hurry up and do this. So that's been nice. I've been off of it for a week, feeling good. Another thing I asked her about was whether or not I could take my melatonin, and she said, yes, I can, which I feel like over the last week has really made a difference with my sleeping. I'm still having bouts of insomnia. For me, insomnia is usually like I wake up and go to the bathroom and just cannot go back to sleep. So I'll be awake for a couple of hours and then fall back asleep. It's just kind of like a thing, but it's fine, whatever. But I definitely feel like the melatonin is helping me fall asleep a lot faster. When I stopped taking it, I struggle with like my brain racing. I have a really hard time shutting it off. So I feel like it's definitely helped. Last night was probably the best night of sleep I have had in months and months. So I feel good. Happy about that. Also I found out at that appointment that I have an anterior placenta, which just means that it is on the front side of my uterus. So a lot of times women with an anterior placenta, they don't necessarily feel movement as soon. It can take a bit longer, which I'm pretty sure in my last video I said I felt like I was feeling movement. I honestly can't be sure if I am or not. I haven't really felt anything since I filmed that last video that I feel like I can be sure that that's what I was feeling, but I think I'm just gonna kind of chalk it up to being, you know, I don't know, maybe it was like gas bubbles, whatever. It doesn't really matter. So, oh, there was one more thing I was gonna throw in there. Anterior placenta, whatever, it's gone. So then we had last Thursday. So last Thursday we had the NT scan, which is the nuchal translucency scan, which they do. It can be a screening for Down syndrome. What they do is they go in, and at this point usually they do it between like 11 and 13 weeks, I think, but the baby has like a skin fold or like a pad on the back of its neck, and if it's, you know, a certain measurement, like I think it was 3 millimeters, was it 3 centimeters, one of the two, 3 or more of whatever the measurement is, can be indicative of Down syndrome. Now obviously this is not diagnostic at all. It's just a screening. So we went and had that done. And the ideal position that they need the baby to be in to do this scan is laying on its back facing up. And when she initially started the ultrasound, our baby was laying face down, kind of like on its head. And it was like not moving at all. Like it was dead asleep. Heart rate was great. It was 145, which has been, you know, what it has been running. So she's like, well, why don't you go pee a little bit? Because I had a super, super full bladder. And then she's like, I don't know, you know, move around. So I'm like doing hip rolls and like trying to like jostle my belly. And so then when she gave me like maybe 10 minutes or so. And so then when she started again, it was like flipping and flopping all over the place. I did a backwards somersault at one point. It was really funny. It was very cute, but everything looked great. All of the measurements for the NT scan were perfect. They also did a pretty thorough scan of all of the, like the major body systems, and everything, from what they can tell, look really good. So that's very reassuring. I felt really, since I've had that scan, I feel really, really good about everything. I also had blood work done. It was the Cellfree DNA testing, where they take a sample of my blood, and it's another screening for a few of the trisomy, genetic disorders, and maybe something else. I'm anticipating I should get those results this week. So here's hoping everything comes back fine with that. Again, that is not diagnostic, it's just a screening. So if something came back abnormal on that one, they would probably want to do more testing for diagnostic purposes, and that would be either like an amniocentesis or chorionic villus sampling, which both of those are can be fairly invasive. So that's something that we would obviously discuss with our physician, weighing the risks versus the benefits, things like that. So the scan went well. What else? Oh, so I had a bunch of labs drawn, just like my antenatal labs for my OB's office, and I am always anemic. So my hemoglobin is always like right around 10, in the 10 range, and my hematocrit is always right around 32 or 33, I think. And that is like regardless of increasing my iron intake, like through my diet. I take, you know, my prenatal has iron in it. It's just like kind of how I've always been. So the labs that they drew, you know, tons of like different kinds, like my RDW is always off. I'm not even going to go into basically all of the things are usually off on my blood count. And I remember last year my general practitioner had questioned whether or not maybe I had a form of thalassemia. And the report from my labs also questioned, if, anemia due to blood loss is ruled out, then to consider alpha thalassemia trait, which is basically just a genetic disorder. And if I do have this, which I really suspect that I probably do, basically the only symptom is just like a mildly anemic, blood count, which is basically what I've got. So thought that was kind of interesting. There's really no treatment for it. There's nothing we need to do other than keeping a close eye on my blood count, which they do anyway for all pregnant ladies. That's it. The whole like breathlessness thing has definitely been a thing in the last week. Like I find myself needing to take really deep breaths all the time, especially if I'm talking a lot. So that's something that has increased in the last little bit of time. And lastly, skin changes. So back in April, when I started doing keto, one of the things that I had prior to starting keto was a lot of women with PCOS can develop, I can't remember the actual name of it, but it's like darkening of the skin in like your skin folds. So a lot of women get it on the backs of their necks, they'll get it underneath their arms or in their thigh creases. And that's definitely something that I had developed. So I had a spot on the back of my neck that was probably I'd say about that big, that had developed over the prior, I'd say 6 months or so. So within 2 weeks of starting keto, it was gone, completely gone. And so since having stopped keto, it is back, and it is back with a vengeance. What causes it is just kind of like the hormone imbalance of PCOS and insulin resistance. So it is definitely back. I think it's bigger. It's really irritating. Like sometimes it gets like really itchy, like intensely itchy. And I actually have a little bit on the front of my neck too. I don't know if you guys can really see. It's kind of hard to tell because of the shadow, but the front side doesn't really bother me. It never itches or anything. It's basically just like a discolored patch that is kind of rough in texture. So that's been a little bit annoying, but honestly, once I stopped keto, I kind of anticipated for that to come back. And I think that, especially the patch on the back of my neck, I think that it is definitely hormonally driven at this point because of all the pregnancy hormones. Because my A1C, I had that checked, a week and a half ago, 2 weeks ago, 2 weeks ago, and my A1C is totally fine. So, I know that my insulin levels have been okay. So, kind of like ruling that out, I'm chalking it up to all of the pregnancy hormones. So that's cool. That's real glamorous. Okay, well, this has been almost 20 minutes and I should probably get to doing the things I need to do. So, thank you for your patience. Before I forget, our anatomy scan is going to be when I'm 22 weeks, which will be, when is our anatomy scan? It's on Valentine's Day of next year, so excited about that. Anyway, next video, reasonably, is probably going to be in the new year, just because, like I said, we are going back to Illinois for Christmas, and we won't be back here for like 10 days or so, so I hope everyone has a really good holiday, whatever it is that you're celebrating. And thanks for watching. I'll try to keep if anything comes up, I'll try to keep my Instagram account a little bit more updated. And just because I said that, we all know that it probably won't happen. But thank you again for watching. Thanks to everybody that has supported me throughout this really kind of like incredible journey. I really appreciate it. Okay, I'll talk to you guys later. Bye.